Hi, welcome back to the channel. My name is Molly, and today at Live UTI Free, we're chatting with Dr. Heidi Peterson about treatment and recurrent UTIs. If you're new to our channel, be sure to check out the description below, as we've linked to other resources that you might find helpful. Lastly, if you enjoy these videos, think they're important, and want to support what we do, be sure to hit subscribe and tick the bell so you get notified when we post new videos. And other than that, we hope these videos provide the insights you need to take the next step on your UTI recovery journey. Welcome, Dr. Heidi Peterson, and thank you for joining our Clinician Insight series to discuss recurrent and chronic UTIs.
Thank you for having me. I'm so excited to be here today.
Amazing, thank you. So can you tell us a little bit about yourself, including where you're based, your practice, and how you got here?
Sure. I'm a naturopathic physician in Portland, Oregon. I've been in practice since 1999. And I've been passionate about, well, particularly women's health, but just health in general. My whole career, I taught women's health at the Naturopathic Medical School for 19 years. And I just see so many, particularly women, dismissed with their health issues and not addressed properly.
Yeah, definitely. So when it comes to UTI diagnosis and treatment, what type of patients do you tend to see?
I see all types of patients. While I would say the predominant patients in my practice are women, I see men, transgender. I'm happy to help anyone in need.
Amazing. You mentioned transgender care there. Are there any differences in your approach when it comes to transgender care and UTIs?
Well, I think there are some differences. One, just being respectful of the patient and their needs and their identity. But, when it comes down to it, a human body is a human body. And so there isn't differences. Sometimes if they're on hormone replacement therapy, that can affect the tissue as well. But, I think it's really more just being sensitive in how you interact with the patient. But the actual treatment itself really isn't that different.
Yeah, definitely. Okay. So do you tend to diagnose based on testing alone or in conjunction with patient symptoms?
Well, historically, I just based on patient symptoms, but since about 2000, I've been doing PCR testing, which has just been a dream come true for me. And, I always had this suspicion that patients had underlying UTIs that the testing wasn't showing us. And it's just been fantastic now with PCR based testing to actually get the diagnosis that I actually thought was there. The other thing that I think is really important is that depending on the anatomy of the patient, with people with vaginas, I'm also going to test the vaginal microbiome as well as what's going on in the bladder, and for people with prostates, I'm also going to assess the prostate microbiome as well, because I think there's so much crosstalk, and I think sometimes when providers just focus on treating the bladder and don't actually treat the sort of surrounding tissue as well, they won't have as much treatment success.
Can you tell me a little bit more about your testing process when you meet a patient, what you tend to do first?
Well, I obviously take a good patient history, and I think that is very important. All of my patients' visits are an hour long, and I think that I have success with chronic cases by really sort of drilling down and finding out when things first happen. And I saw a patient this week, and this is not uncommon. She's really had chronic UTIs since she was 20, and I think that's really important to know, because when you have these patients that have had UTIs for like 20 years, treatment is going to take a long time. And I really want to, set up that expectation. Like, I really think I can help you, but this is a 20-year problem. We have sort of a rough rule in naturopathic medicine that you need a month for every year, a month of treatment for every year you've had a problem. So, this patient that's had UTIs for 20 years, it will probably take a couple of years to fully sort it out for her. And then I generally start with the PCR testing. I think that that's really important. Of course, I am a more holistic in my approach, so I am going to want to look at, just laboratory tests and patients' medical histories and make sure, that they're not hypothyroid, if they're not, menopausal and the hormones are too low, that they're not deficient in iron or vitamin D and all these other things that are so important for immune function. Because if you're having sort of some of these more global health issues, it's really going to affect how your body can fight these infections.
I've learned that stress is quite a big one, and when speaking to other clinicians, they find that's a big indicator when it comes to UTIs as well.
Hugely stressed. And, along that topic, I think trauma has become such a hot topic, and so many people that have a trauma history that causes a lot of stress in their body and really can affect issues in the pelvic floor. I always like to remind people that your pelvic floor muscles are the same muscles in a dog that causes the tail wagging, and a lot of motion will go to those muscles. And so, a lot of people will hold stress in their pelvic floor muscles, and if the pelvic floor is really tight, that really can affect how well treatment proceeds.
Are there any common challenges you see patients facing when dealing with recurrent UTIs, and how will you help patients overcome these?
Well, I think first, just realizing that they actually have a chronic infection. I mean, I think so many patients will go to their provider and they'll do a urine culture, and they'll either say, "Oh, there's no pathogens there," or "Those are normal flora," and so I think that is a huge problem. I think another problem is antibiotic resistance or overuse of antibiotics. And I certainly prescribe antibiotics, and I think that they're a great treatment. And yet I always feel like there's a phase where they kind of fail. So I often will start with antibiotics just because they're easy, they're fairly inexpensive, and they're accessible. But at some point, I don't find that they actually always work 100%. And that, after I've done maybe a couple rounds of antibiotics, if they're still testing positive for pathogens, then I'm really looking to other treatments. One of the treatments that I do in my practice that I'm really excited about is ozone therapy.
Could you explain a bit more about ozone and your approach?
Yeah. So ozone is O3. People might sort of know ozone, if that sort of smell in the air after a thunderstorm with lightning. That is O3. O3 is an unstable molecule that quickly breaks down into free radicals and oxygen. Ozone is really amazing. It's bacterial static, it kills viruses and fungi. And one of the things that's really great about it is that it's a physical treatment versus a chemical treatment. So these pathogens can't become resistant to it. People don't actually realize, but ozone is actually made by your body. So there are neutrophils that will do it. And human cells actually have a way to neutralize it. So it's not harmful to the human cells except for the lungs, but otherwise it's not harmful to human cells. But it is harmful to all of these other pathogens. It also breaks down biofilms, and I'm sure other people have talked about this. I think one of the huge problems in treating these chronic infections is that the pathogens are often hiding in biofilms. And, there's research that if a pathogen is in a biofilm, it takes 1,000 times the antimicrobial agent to kill it than when it's in the wild. And so it's really handy that the ozone, while it's antimicrobial, at the same time will also break down the biofilms. It's anti-inflammatory. It breaks down mediators of inflammation. It's analgesic. It breaks down mediators of pain. And it's also immune regulatory. So it'll stimulate the immune system, but without overstimulating it, that some things can do. And then the final bit is ozone does break down into oxygen. And so you'll get an increase of oxygen in the tissue, which actually then promotes the tissue to heal as well. So I do feel like it addresses like sort of all of the issues that we're looking at when we're treating these chronic infections.
You've mentioned antibiotics and you've mentioned ozone therapy. Is there any other treatment approaches which you look at when an infection is identified?
Well, certainly I'm a naturopath, so I will do herbal treatments as well. I always include, a biofilm agent. I also specialize in chronic complex illness as well. And sometimes when the cases are really challenging, you have to look a little bit more globally. Like, do they have a chronic vector-borne illness like Lyme? The other thing sometimes I look at, I'm trained in environmental medicine. Sometimes if people have been exposed to mold, toxic mold in a building, that they will get exposed to these chemicals called mycotoxins, which are the poisons that make in the mold war. One of the main routes of excretion for mycotoxins are actually in the urine, and in fact, many ways that we test for them are urine samples. So if the urine is full of mycotoxins, that's immunosuppressive. So that can be another, barrier to people getting better.
I think a big thing in our community is the overlapping symptoms, and it's quite hard, like you mentioned, establishing what needs to be targeted to be treated first, because some of the symptoms are very similar.
Yes, yes. No, it is very complicated. And, sometimes with my patients, I make the analogy that treatment is a little bit like rock climbing, where, you might sort of focus on one area for a while, and then you might go to another area and then come back. It's really, really challenging. You can't treat all of these things at once. And I think that's, it's sort of a journey that you're on and trying to figure out what is really the biggest driver behind the chronic infection. And I don't think it's always the same for everybody. And that's what makes it so hard.
So, what advice would you give to someone who suspects they have a UTI but are maybe testing negative?
Oh my gosh, find a good provider. But I say that and as if that's an easy thing to do. And, I think right now it seems like at least post-COVID in America, it's really hard to find any doctors or to get anywhere. And I think really, using your network of friends and colleagues and doctors, and just asking around for someone who actually believes in this and will do, will do the PCR testing and will do the deeper dive. But I think it's really demoralizing when you really feel uncomfortable. And I think most people who've had a UTI know what it feels like and know when they have one. And I think it's just horrible when you go to a provider and they say you don't. And I get frustrated. Many doctors in America, quote unquote, don't believe in the PCR testing for UTIs. But I'm sort of like, but you use PCR to diagnose COVID. And I don't really understand that if you believe in it for COVID, why don't you believe in it for UTIs? Like, it's very baffling to me.
So, are there any typical conditions that we mentioned, like overlapping symptoms and conditions which you have to target? Are there common conditions that you find link with UTIs?
Oh, so many. Well, first of all, in older women or older people with vaginas, you really have to treat the decrease in hormones. And I think, that needs to be addressed properly. And I actually get quite frustrated. In America, they often will prescribe estrogen cream to women with chronic UTIs, but the standard way to apply it here is with an applicator. And I think you kind of miss the boat, because I think one of the most important things when when women have UTIs is to apply estrogen actually over the urethra and the top, in the opening of the vagina and the top of the vagina, to get the front door closed. Because as I tell people, estrogen is like Lycra in your tissue, and as you get older and your estrogen levels drops, your tissue sags everywhere, including the urethra. So when you do an exam and I can see the urethra just hanging open, you got to close the front door. But so many ways that patients are instructed to do these treatments actually aren't targeted to the most. They're not applying the hormone where they actually really, really need it. So I think, that is a huge, huge obstacle. And then, like I said earlier, maybe looking at these big, looking more globally and not just always being like, what's the antimicrobial or what's going on with the bladder, but really doing a global health assessment to see why their immune system isn't really clearing the infection. Because I think people kind of forget in this age of antibiotics, and they really think, oh, the antibiotic clears the infection. And that's not actually true. The antibiotic will get the level of the pathogen down, but at the end of the day, it's really your immune system that's clearing the infection. And so if you've done lots and lots of treatment and you're not having success, then I do think you have to question, what is going on with the immune system, and why isn't it clearing these infections?
That's really interesting. Do you have any advice for individuals for preventing future UTIs?
Well, certainly, I think, frequent urination, and it's very sad. I've had to write the letters here for my younger students that many of the like high schools here, they don't want students leaving the classroom to go to the bathroom, and so I'll write these letters of medical the next that so and so it's medically necessary that when they need to use the restroom they can use it, which I think is ridiculous. But
Yeah.
I think also can apply to teachers. I've worked with teachers and they aren't given restroom breaks, or many people in their workplace environments are not doing that. And I think when people need to urinate, you certainly want to have that opportunity. Certainly, drinking plenty of water. Although I do want to tell you something that changed my treatment protocol a few years ago when another provider pointed this out. You certainly want to, hydrate a lot, and that really helps keeps the bladder flush. Except for if you are taking an antimicrobial agent, whether it be herbal or antibiotics, that is actually a time you don't want to overhydrate, because then you're actually diluting the antimicrobial effect of whatever you're taking in your urine. So I think a lot of patients with chronic UTIs sort of got the memo to overhydrate, but that actually isn't good during antimicrobial treatment. Obviously, urinating post sex is really helpful. Something that everybody should be taught, but some people aren't. I'm actually a huge fan of bidets. So you can buy, for in America, about $300, these little bidets that you can install on your toilet. And they have sort of different settings, and they have sort of a setting to clean the rectum or the rectal area, and then they have a more anterior setting for the vagina. And I think that is a really, really great way to sort of cleanse the tissue, after urinating or after sex, and really healthier for the tissue. Toilet paper is actually not healthy for those sensitive tissues. And if you've got chronic irritated tissues, that really using a bidet is better. And of course, I laughed during the pandemic in America. There was, people were panic buying toilet paper, and I'm like, well, if you just have a bidet, then you don't have to worry at all. So that is a really great for chronic UTIs, but also I recommend it to my patients with digestive issues, and just in general, it's healthier for those tissues. So I certainly like things like cranberry and D-mannose. Probiotics, I'm a huge fan of. And, I do really, the probiotics have become more specific, and that, there are probiotics for your mouth, there's probiotics for your nose, and there's particular strains that are more specific for the urogenital tract. And so lots of my patients will come in and they'll be on probiotics, but I'm really going to put them on looking for rhamnosus and reuteri and cryptatus, like really those strains that are specific for the genital urinary tract. And so I think if you're struggling with chronic UTIs, you really would, or even preventing, making sure that you're getting in some way in your diet or from a supplement those strains that are specific for the genital urinary tract.
Thank you. That's a great list to go with. So how can patients contact you if they'd like to inquire about working with you?
Sure. I have a website. I have drheidi.com, doctor spelled out, and they can inquire working with me. I will tell people that unfortunately, the ozone therapy, which I find really amazing, has to be done in person. But there's the American Academy of Ozone Therapy for American-based patients, and I know that actually there's quite a bit of ozone therapy in Europe as well. I know the main textbooks come out of Spain. I apologize, I don't actually know what the group over there is called, but I do know that it's available. So if people are interested in that, I'm quite happy to work with them, but that does sort of require them to come in person.
Well, thank you for providing us some insight into the testing and treatment methods for the use of chronic and recurrent UTIs. I will include your link to your practice in the description below for those that are interested.
Well, thank you. And I just, I want to close and tell people there is hope and you can get better, and just don't give up, and don't let any provider bully you into thinking that you don't need help.
That's amazing. Thank you.
All right, thank you.
Thanks so much for watching. I hope you found this video helpful. You're always welcome to reach out to us for more information about clinicians who specialise in recurrent and chronic UTI. Our contact is in the description below. If you'd like to learn more about this or related topics, be sure to check out our other videos or head over to liveUTIfree.com for other articles on recurrent UTI treatment options. Of course, if you like what we're doing on this channel, make sure to hit the subscribe button here on YouTube and tick the bell so you get notifications about future videos. Thanks so much for joining us for our Clinician Insight series. If you have suggestions for who we should interview next, be sure to drop us a comment.